Hello, I am Dr. G K Sinha, working as technical advisor at Apollo College of Veterinary Medicine, Jaipur. Basically, I am a veterinarian. My talk will be concentrated on zoonosis. This talk will be useful for all the pet owners, livestock owners, veterinarians, and all people who are interested in life sciences. Those who are doing BSc, MSc, doctorate in matter of life sciences, and it will be useful for them. You see, we should know about the animal diseases transmissible to human being, and this part is known as zoonosis. Zoonosis is it's a well-known term, and zoonosis is well known in our country also. It's a very big chapter, and it cannot be done within a short time. But I will put myself and concentrate or on few diseases which are quite common and the people are not or little bit aware of it. It's very important, and I will consider your interest in this. Now the point is that what is what are the causes, how it happens, how diseases, how zoonosis occurs. There are many causes. You see, bacteria, one cause is very common, it's a bacterial cause, and under that bacteria, anthrax is very important. It's a very important disease, anthrax, which causes bad condition in the human being. It's an important disease in cattle, in cows, buffalo, and it affects the human being also. You see, then another disease under the bacterial heading is brucellosis. Very common in cow, buffalo, and other animals, and it is a bad disease actually in animals, in cows. It causes abortion in late pregnancy in the cow, in the buffalo, and the same infection, that is Brucella abortus, it the bacteria, the brucella, it can affect the farm worker. The workers who are working in the farm, they are spending time right from the morning to evening. They remain with the infected animals, and they may contract the disease. And you see, in human being, it will affect the joint. Knee joint is generally affected with this condition. So we should be aware, and once the animal has been diagnosed in the form of brucellosis or becomes brucellosis positive, we should eliminate that animal. The other disease is encephalitis. That is also a bacterial disease. Encephalitis means the inflammation of the brain, and it causes, it is in animal are affected, and the same bacteria, it causes the disease. Then the other very important is Salmonella infection, very common. Then the other disease, which is, you see, everybody knows in this country also, plague. Plague was, it created lot of havoc in our country long back. I'll be talking about this disease in little detail. Plague is also caused by it's a bacterial infection. Then the other point is rickettsia. Rickettsia is an important disease of the human and important disease of the animal, and it causes, rickettsia causes Q fever and typhus in the human being. From animal, it comes to animal, human being. The other important cause, we are talking about the causes actually. The other cause is fungal infection. Till now, I have talked about the bacterial causes, the viral causes, rickettsial causes, and now under the viral, I must again repeat that very important disease caused by the virus. I think everybody knows, all the pets owners also knows that rabies, जिसको हिंदी में पागल कुत्ते ने काट लिया आदमी में, अगर किसी पागल कुत्ते ने काट लिया है आदमी को, तो उसको, उस डिजीज को रेबीज बोलते हैं। यहाँ अपने को ये जानना जरूरी है, वी शुड नो कि एक बार अगर पागल कुत्ते ने काट लिया है और डिजीज आदमी में अगर हो गया, इन्फेक्शन हो गया है, तो अभी तक अपने पास में वी डोंट हैव एनी मेडिसिन, कोई दवा नहीं है। वैक्सीनेशन जरूर है और तुरंत उसको वैक्सीन लगाई जाती है, सीरम से इलाज किया जाता है, बट इट इज वेरी वेरी डेंजरस इन द ह्यूमन बीइंग। डॉग में भी अगर रेबीज हो जाता है, वायरस डिजीज है ये, डॉग में रेबीज होता है, तो उसको बचा नहीं सकते, और एकदम डिजीज रेगुलेशन है कि उस अफेक्टेड डॉग को, इन्फेक्टेड डॉग को डॉग वार्ड, रेबीज वार्ड में वहाँ पे भर्ती करा देते हैं, और वहाँ कोई जाता नहीं है, दूर से ही उसको पानी वगैरह खाना दे दिया जाता है। और रेबीज का अफेक्टेड डॉग वो 10-11 दिन से ज़्यादा सर्वाइव नहीं कर सकता, कोई इलाज ही नहीं है, देयर इज नो मेडिसिन फॉर दैट, नो ट्रीटमेंट। Similarly, I will tell you, I will little stress on this disease, this is very common, and I think all the pet owners, all the livestock owners, the people also, they know about this disease. The municipal corporation of the town, whether it's a Delhi, Bombay, Jaipur, Calcutta, or Bangalore, and anywhere, they are also, they do lot of preventive work, and they regularly vaccinate the animals, dog, against the rabies. That's very, very important. It's a rabies vaccine is very, very common. Actually, all the owners also knows. Now, the important thing, what I want to tell you, that if a rabid animals means the dog which is affected, which is already suffering rabies, the life tenure of the dog, again I am telling you, it will not exceed more than 10 days. 10 days, 11 days, lot of salivation and all that. Now, if that dog bites a human being, what is going to happen? You see, what will happen, that if the saliva of the dog at the time of bite, saliva goes inside the body of the human being. That human may be lady, gent, child, or anybody, a small, young, adult, anything, and the saliva goes. That saliva contains millions and millions of rabies virus. It is full. It is full with the virus. So there are chances that the the symptom will develop in that human being also. So what we should do? Immediately I will tell you, I mean, a little, I told you that I will be talking little about rabies in the human being. We should take the patient to the hospital, and before, you see, before what we should do at home, water is the best treatment for it. Immediately at the site of place, at the site of bite, I am talking you, that lot of water should be poured down. पानी से उसको धोइए, नल के नीचे, अगर हाथ पे काट लिया है तो उस हाथ को नल के नीचे कीजिए और नल को खोल दीजिए, और वायरस 90% वायरस उसी पानी से धुल जाएगा. Don't go for any antiseptic and all that. Nothing will do. Water will harm, and water may control little bit. It will help. After doing all these things, then of course you take the patient to the hospital in the emergency, and they will vaccinate, and they will do many other things, rabies serum and all that. Now, what happens? How the rabies happens? How the symptoms in the human being? You know, I think I must tell you that virus of the rabies, it's a viral disease. Virus of the rabies, it has a road in the human body, and that road is nerve. If the virus remains only in the blood, nothing is going to happen. It will catch the nerve root. Suppose the dog has bitten in the leg area, and now we think that from the leg, the distance of our head, brain, is quite a bit. It may be 4 feet, 5 feet, 6 feet even. So it depends on, so the virus will travel through the nerve, and it may take, if the distance of bite and the brain is near, it may take 10 days, 15 days, 2 months, 3 months. But if the distance is quite at a bit at a distant place in the body, then it will take 2, 3 years, 4 years even to reach the virus will reach. Slowly, it goes in the brain. And the human, you see, will become mad and he will start biting other, fighting and all that. And I tell you very frankly that most of the cases of madness in the village area, they have been, because history says that his grandfather or the father will say that this child, this boy was bitten some 10 years earlier by a rabid dog. So it's very difficult. He will not survive, and just by with this symptom, he will cry, he will bite others, he will. Some people even chain they put chain on such patients, and the human will die. So, what I want to say you that there is no good medicine for rabies. So we should be very particular if we are keeping the pets in the home. A regular vaccination against rabies is very important, and immediately we should not delay. If a human being, a child or the adult is bitten by the dog, a rabid dog, he should be immediately taken to the hospital and all possible treatment should be done, and lot of care has to be done. The very important thing, आपने आपने सुना होगा कि पानी से डर लगता है उस पेशेंट को. What is that? Fear from the water. Fear from the water. ह्यूमन में, आदमी में जिसको रेबीज हो गया है, वो आदमी पानी से डरता है उसको, and that is known as hydrophobia. That is a very important symptom. His voice will be very harsh. It will not be a normal voice. It will be very rough and harsh voice. It will be. Then itching and all that, everything will be there. He will behave like a mad person. So, what is my feeling? What is my advice? All pet owners, they should get their dog vaccinated every year in time. Now, a vaccinated dog also. Suppose that vaccinated dog is bitten by another dog, a rabid dog, then also again revaccination is necessary. And it should be the same thing should be followed in human being also. It's a very bad disease because we don't have any medicine for this thing. So this is important. One viral I have little bit explained you. Another rickettsial, I told you, one important disease is Q fever, which you have heard in the paper and all that, and typhus. These are two. We shall talk in detail. A small detail. Then the other infection is fungal. Zoonosis is also caused by fungal disease, and very important, very common disease caused in the under the group of zoonosis is ringworm. Ringworm, I must tell you, it happens in the human being, and mostly ringworm is just like it's a round patch on the skin, mostly on the neck region, on the back side, पीठ में हो जाता है लोगों को. It also happens in the कमर side, waist में, and in the other part of the body where a lot of moisture and all that there. So this disease, it can be transmitted from a infected animal to the human being, and it is a ringworm. And of course, antifungal medicines we have, but a lot of scratching is there, and diagnosis is not very difficult. Ringworm, but in some cases, you see, ringworm on the neck region, it's just like a सिक्का, ₹1 का सिक्का वो गर्दन पे चाहे पीठ पे हो जाता है. And I have seen some cases that the lesion in the human being, it is lasting for 5, 6, 10 years even. And because why it happens? Because that ringworm, basically it was a simple ringworm. It's a fungal infection. But later on you see bacteria also, they also invade that lesion. And therefore it becomes complicated, and it becomes out of control, scratching and all that. And this is known as ringworm. This is due to fungus infection, but we have got good medicine. One should go to the skin specialist and he will treat it. Then other disease, protozoal, very important. Protozoa. Is a small, very minute organism. I tell you one important disease, toxoplasmosis. Very dangerous disease. It caused by toxoplasma, and it is also transmitted from the animal to human being. Toxoplasma. Then leishmaniasis. आपने सुना होगा leishmaniasis, बिहार, उड़ीसा, बंगाल, काला जार सुना होगा आपने. Very dangerous, leishmaniasis. So leishmania is also caused by, and it's a lot of, you see, money has been poured by the government of India for control of this disease, but it happens in such areas. It can occur in anywhere. I mean, it can occur anywhere, but leishmaniasis is very important. Toxoplasmosis is very important disease. Then the another disease is trypanosomiasis. This is also a protozoal infection, and I tell you, you'll surprised to know about it. Protozoal infection, trypanosomiasis, is quite common in India in the animals: cow, buffalo, dog, sheep, camel, and everything. In camel, it happens here, and it is commonly known in Bikaner and Jodhpur area in India as a 3 years disease. It's a Trypanosoma evansii. Now, under this category, why I have taken this for zoonosis? Because under this category, there is Trypanosoma gambiense, which affects the African people, and it causes sleeping sickness. Sleeping sickness. The person who are affected with Trypanosoma gambiense, they don't have sleep. They don't sleep. Sleeping, sorry, I mean, they will sleep. They will sleep. And slowly, they will become very lean thin and may even lose their life. So, trypanosoma is a protozoal disease. Now we come to another helminth. We are talking about the causes of the how zoonosis takes place. Helminthic disease, echinococcus. Actually, this is a parasite which also affects the human being. Then everybody has, I think we all know about, you also know, all the listeners, all the dog owners, livestock owners, and all that, and everybody, all that tapeworm you have सुना, आपने सुना होगा. Tapeworm छोटे बच्चों में हो जाता है, बड़े में भी हो जाता है. And tapeworm जो है वो it is from the dog, transmitted from dog to the human being. So this is a zoonosis, and many other. I mean, it happens. Peniasis, this is known as tapeworm, pig, and then there are like this. There are many other diseases, parasites, helminthic, which can from animal, it can come to the human being. Then I come to a very common condition. It is ectoparasites. Sometimes some parasites which can be seen even by the naked eye, that also causes disease condition in the human being. As for example, there is one very common disease which is known as scabies. Scabies, Sarcoptes scabii. The causative organism cause करने वाली जो बीमारी है, जो ectoparasit है, that is Sarcoptes scabii. अगर आपका डॉग को खुजली हुआ है, खुजली हो गया है, तो वो खुजली डॉग से आदमी में, ओनर में, उसके बच्चे में, और जो डॉग को जो देखता है उसमें हो सकता है. And scabies is it's a very bad condition actually. Medicines are available, lot of medicines are available, but then if it is not, if care is not taken, then definitely it will affect the skin, and lot of itching and everything is there. Lot of itching is there. Medicines are available, but itching is, and if uncared, then it will spread also. Scabies is khujli in the human being. it can pass on from your pet, from the dog to the human. We see, I have seen even in good family, you see the child plays with the dog, and if the dog is suffering scabies, khujli, then the child may contract the disease. So it is an unhygienic condition, and it will create trouble in the skin. Now, many things are there, and we shall come to some other condition. Some of the, you see, I told you little about rabies. Rabies again is a direct bite from the dog. So we call it as a direct zoonosis. I mean, not going much in detail about this, what type and how it causes it, because a lot many people are listening me, and a simple talk I want to give you. But anyway, I want to talk about some other conditions which can be useful for you. You see, in our country, zoonosis. You see, if you remember bubonic plague in India long back, it was recorded, and bubonic plague. अब आपको आश्चर्य होगा ये सुन करके कि bubonic plague ने करीब 12 million public people died since 1889. It was and लोग गांव छोड़ के भाग गए थे, चले गए थे. Many people died. Then 30,000 deaths हुए उसमें due to rabies every year. आपको बहुत सरप्राइज होगा, अब ये फिगर और बढ़ गया है क्योंकि डॉग पॉपुलेशन बढ़ गया है, and we are not very particular. You see, all the good pet owners are vaccinating, but there are many people, they are just street dogs. They are not being vaccinated, and therefore rabies is staying in our country also, and thousands of dogs are affected with the rabies, and vaccination is the only cause of this. Now, again, I talk to you about the plague outbreak in Surat, India. There's a place here, Surat, in India, in 1994. It's created havoc. People left the town. So many people died. You see, from the about 500,000 people from the region, and WHO estimated outbreak, and they said that this outbreak must be controlled, otherwise there may be outbreak. So we have to be very careful about this disease also. Then bird flu. India suffered bird flu. It's very important. Bird flu. They are all zoonotic diseases. India suffered bird flu, and in 2006 also there was a lot of the poultry industry, and you will feel surprised that many farms who had 10,000, 20,000, 50,000, 20,000, 15,000 birds, they just killed their birds and dumped into a gadda karke usko khatam kar diya, and the compensation was also given by the government. It happened in many other countries also, around near about countries. So it's a very important disease, bird flu. Now, the other thing, very common, is tuberculosis. Everybody knows it. Tuberculosis, So tuberculosis, as the organism is Mycobacterium tuberculosis. Very important. And details we can't go in such a short time. There is a big books on tuberculosis, but some very important thing I want to tell you, and that important is that please keep in mind that tuberculosis can cause the disease in any organ of the human body. Any organ, right from the head to the toe, tuberculosis can be there. TB can cause disease, Mycobacterium tuberculosis. It can cause disease in the human being right from the head. Head means what? Head has got hairs. So TB of the hair आपको सरप्राइज होगा सुन करके, बालों का टीबी हो जाता है। और टू दी टो, तो टो में क्या होता है, नाखून होता है, ये नाखून है, तो टीबी ऑफ द नेल। So you see why I'm telling you this is very, I mean, many, only few people knows about it. Those who have studied this thing, tuberculosis, they only know. Otherwise, what we know? We know only TB means, जैसे ही बोलेंगे TB means what? लंग का डिजीज, फिर वो फेफड़ा खराब रहता है। फेफड़ा तो होता ही है, बिकॉज इट इज ए, if a patient is there and he is talking, then he is breathe, उनकी सांसें हम ले रहे हैं, वो हमारा ले रहा है, and the infection will be established in the lung, and then slowly it will go in other part of the body. But फेफड़ा तो ही है, that is the predilection site, important site है फेफड़ा, it's very very important. So TB can cause disease in any organ of the human being. Now, the other point I will tell you, because this is, we're talking about zoonosis, how milk, if the cow is suffering TB, then the milk may contain tuberculosis organism. And if the milk is not boiled properly, and if it is taken, and suppose the human has got something wrong with the intestine, this I'm telling, please listen carefully. I'm talking that if the intestine has got some ulcer and all that, and if that infected milk goes, then Mycobacterium tuberculosis can establish in that ulcer and cause what? Intestinal TB. Intestinal TB. So it is not only the lung TB we have, but it can result there. So keep in mind that TB must be diagnosed in a farm or in the animal, and the milk taken from such, I mean, it should be boiled very well, and then only it can be consumed. We have got very good medicine, lot of medicines are there, and TB earlier, some 25, 30, 40 years, it was incurable. Now TB is well cured, and only thing that a system of medicinal aspect has to be followed, and TB can be controlled very well. I think few diseases I have talked to you, and in my next lecture I will go for more zoonotic diseases. Thank you very much for listening me. Thanks.